Hey guys, it's Dr. Justin Marcagiani here. Welcome to the Friday Q&A. Let those questions roll in. Hope everyone is having a phenomenal Friday. Best time of the week. Got my nice butter coffee here with some collagen and good fats going. It's a nice little Friday here in Austin. Weather's just right. Perfect. All right, I got some questions in the queue. All right, so first off here, first question is, I suspect my husband and son both have hidradenitis suppurativa. That's like had about 10 patients in my career with that. It's like an autoimmune condition that causes like the follicles to get super inflamed and they almost pus up and really swell up. It's really bad. Okay, so I have really good experience with this. So number one, there's an autoimmune connection with the hidradenitis suppurativa, autoimmune. So autoimmune diet is step one. Number two, like kind of do an audit, right? How are they doing hormonally, energy, mood, focus? How are they doing digestive wise? So the first thing is autoimmune diet and make sure their digestion works, right? Make sure HCl, enzymes, make sure all of that's 100% dialed in. Make sure we test for infections. And of course, like we can go through the whole entire functional medicine workup where we dive in deeper. But just to start off, digestion, autoimmune diet, and just start there. And then we can go deeper down the road of infections down the road. Hope that helps. I'll be consulting with a potential nutritional therapy client who has a damaged liver due to alcoholism. What things would you do to support his recovery? Great question. So number one, you really want to make sure the diet's dialed in. So some kind of like a ketogenic paleo diet, lower carbohydrates. Carbs can be harder on a damaged liver. So I would keep the carbohydrates lower, really good amounts of fat. I would be using herbs like milk thistle. Milk thistle has been shown, or silymarin, the same thing, to regenerate those cells, those hepatocytes in the liver. I would also be using some liver glandular, I think has some beneficial effects there, nutrient-wise. You just got to be careful if it's a guy with the high level of iron. Got to be careful with that. Dandelion root, artichoke, fringe tree root extract. You could also give him a little bit of extra sulfur amino acids or even just some pure glutathione just to help. Maybe his detoxification pathways because of the damaged liver are a little bit sluggish. So I would also be running an organic acid test on him as well and see how he is doing there. Hope that helps. Hey, Addie, hope all is well. What's the difference between PCOS and ovarian cyst? Great question. PCOS is polycystic ovarian syndrome. So that means you got to have more than one, right? If you just have one ovarian cyst, it's an ovarian cyst. If you have more than one ovarian cyst, it's a polycystic ovarian syndrome. So typically more than one. And again, ovarian cysts are typically going to be driven by increase in levels in androgens. Androgens can drive cyst growth. So you can see it with like high levels of free testosterone in a female. You can also see it with a transvaginal ultrasound showing ovarian cyst. And also too, like what happens is under stress, we have dopamine, right? It's a neurotransmitter. When we get stressed, your body will take dopamine and it will burn it into adrenaline. It will burn it up. So that dopamine level starts to drop. So dopamine, it's the brake on prolactin. So as your dopamine levels go down because you get stressed, here's the brake on prolactin. The brake on prolactin starts coming off and prolactin starts rising. And prolactin can start throwing off your female hormone cycle. Just type in hyperprolactinemia in any condition. So you'll see high prolactin levels can really mess up a woman's cycle and it can throw a lot of things out of balance. So of course, you know, insulin resistance, number one, good clean proteins and fats, number two. You can use things like myo-inositol, alpha-lipoic acid, gymnema, chromium to help with the blood sugar, insulin sensitivity, and kind of like a keto, paleogenic, or paleo ketogenic template will be phenomenal. Hope that helps. It's me, Dr. J. I got a question about short-term memory. What can we do to improve? So of course, like anytime we're talking about cognitive stuff, inflammation. So if you're trying to get memory better, get inflammation, all vectors of inflammation from food, from toxicity, chemicals, those kind of things. Like if you use dryer sheets or you use chemicals on your laundry and you're smelling it all day because it's on you, like get all those vectors of inflammation from food, hygienic products, cleaning products, get all those stressors down. Number two, make sure your gut's working well. Make sure you're digesting and breaking down your food. Make sure you're infection free. Now, then if you want to go above and beyond, like little things you can do, little hacks, of course, adaptogenic herbs, extra B vitamins, B6 is really important. Number two, you can do amino acids like tyrosine. You can do smart drugs like piracetam, which can be helpful. You can do PQQ, right? Extra CoQ10, mitochondrial nutrients. Those can be great too. But we don't want to go there and ignore the other things that I mentioned first. So, right, toxins in the environment, toxins in the food, get the gut working, and then you can play around with the other supplements later. Hope that makes a difference there. Let's see here. What is the impact of intermittent fasting on hormones? Done a bunch of videos on that. Again, intermittent fasting is a great tool. If your hormones are already weaker, not a good situation, right? Everyone would say going to the gym's great. You lift weights, you build up muscles, right? No, but let's say you had someone who's incredibly stressed going to the gym, right? Let's say you're taking someone who hasn't slept for a couple days, right? Well, the gym naturally is catabolic. And if your body's already over catabolic, then your body's not going to have enough reserves to then have an anabolic spring back from that catabolic exposure. So whole goal is workout, catabolic reaction. You go home, you rest, you eat, recover, and then you're this much more anabolic, right? So catabolic stimulus, breakdown, tearing muscle fibers, anabolic growth, sleep, protein, diet, rest, hydration, meditation, right? So then you have this net gain right here. So if you're incredibly stressed and catabolic, then your catabolic exposure's here, your anabolic exposure's here, and then you have a net loss of here. Does that make sense? Hope that helps. So again, you want to make sure your hormones are in a really good place. You're feeling relatively good before you do that. A good way to improve testosterone naturally. Well, first thing is sleep. Getting 8 to 9 hours. I mean, you go look at Tom Brady, right? There's a interesting video on him out now, I think on his homepage. But if you study him and you study the things he does, sleep is vitally important to him. Like 9-10 hours a night, like super, super important. So sleep, I'd say, is number one. Of course, you can, add in supplemental amino acids, number two. And then I would say, as long as your gut's working and stress is under control and you're sleeping well, you can play around with some of the herbs that are out there, whether it's ZMA, whether it is tribulus or ginseng. You can do higher dose eleuthero. The Russians did high dose eleuthero in the 50s and 60s and 70s to improve their hormones naturally. When steroids weren't an option. So those can be really, really, really good options for you. Hey, Anna, any questions for me on Facebook? Feel free and let me know. Thanks for joining me here. What's the difference between chicken bone broth and chicken broth? Is it okay to drink them directly from the pack without any heating? Well, I mean, typically the difference I think would be is if you put a chicken, right, in a crock pot and you add water, right? What you get there, you're going to get a whole bunch of chicken broth from there. Now, if the chicken's a whole chicken and also has bones, then you'll get chicken and bone broth, right? If it's just chicken bone broth, then it's imagine just doing a crock pot, but no chicken meat, just the chicken bones. So the difference, I think, is you have a higher concentration of the collagen peptides if it's just purely bone, because there's not going to be any muscle meat or any other parts of the chicken that would go in there to give it flavor. I like doing a combo with it too, because the chicken broth is really nice, tastes really good. The chicken bone broth may not taste as great, but if you get a combo of it, it's really phenomenal. Do you have a preference for a thyroid treatment, Armour versus something natural, not made from animals? So not made from animals. So if you're going to go that route, then you would have to go into a bioidentical type of model. You could do bioidentical and get it compounded at like Clark's Pharmacy. That's an option for you for sure. My issue is, number one, it's the same hormone found in the animal anyway. More than likely, it's being extracted from the animal. So my issue is just take it from the animal, because when you take it from the animal, you get other protomorphogenic compounds that are healing for the thyroid. Now, if you look at all of them in my thyroid book coming out, there'll be a chart in there that compares all of them. But in that chart, you have NP thyroid, which is kind of a newer one. That's got maltodextrin and some dextrose in it, so it's got a little bit of corn sugar. Armour's got similar. Then you have NatureThroid, which is good. It's got 7 ingredients, one of them being lactose. So if there's any corn issues or any dairy issues, there could be an issue. Then there's WP. I like WP. 3 ingredients: thyroid hormone, a thyroid glandular, MCT oil, right? Like what's in my coffee now, and then inulin. So 3 ingredients. So I lean towards the WP just because of its more hypoallergenic constituents. You're going to get T4, T3, T2, which is really important, right? Not tested, but really important. T1, calcitonin, and you'll also get some protomorphogenic compounds in there. Let's see here. Wow, questions are piling up, guys. Yikes. All right. Let's see. Carlos says, I'm 29 years old. I eat healthy and do weightlifting. Lost hair at 21. Can this be fixed? I guess it was due to stress and bad nutrition. So number one, maybe. So in the meantime, I would do some type of like finasteride or like Propecia or like, not modafinil. It's the other one that begins with an M. It'll come to me. It's Rogaine and minoxidil, something like that, topical, just to get the hair follicles stimulated topically. There are some natural ones out there. If you Google Danny Roddy, he has some information on getting your hair back. But number one, you got to get the stress down. It sounds like you're probably there. You got to make sure your gut's doing well and you're able to digest and break down proteins and fats. Add an extra collagen, make sure you're infection free. There's some research doing some really good green juicing. Some of the phytonutrients in the green vegetables can be helpful as well. So some green juicing while keeping the sugar under control. But I would really work on getting that gut 100% dialed in first and see how we do. There is a chance. I mean, you're still young. It's hard to say if those follicles have gone dormant or not, but some topical Propecia or Rogaine minoxidil may be worth adding in, but with the whole program. Sandra says, Dr. J, my 4-year-old's recovering from the flu today. Is the last day he'll be taking Tamiflu. He just started today on an antibiotic due to an ear infection. Any suggestions besides probiotics? Well, number one, I would try not to do any of those. I mean, okay, so like you're in the situation, right? So like next time, number one, I would try to make sure the diet and all that stuff's clear. I mean, I had ear infections like 10 a year as a kid. I had so much antibiotics. And as an adult, like once I cut out gluten and dairy 100% at age 21 or 22, I've never had an ear infection in like 15 years, like zero. So I know without a doubt that gluten and grains drive ear infections, okay? Number two, when kids get sick, Tamiflu, it's not the best, in my opinion. Ginger tea, colloidal silver are going to be your phenomenal go-tos for viruses. Keep the sugar and carbohydrate low because that's going to impair your phagocytic activation, which is the little Pac-Men. They gobble up bacteria and critters inside of you. Up the vitamin C, up the vitamin D. Go watch my recovering from the flu video. All right. But in general, if you're already doing the antibiotics, probiotics, I would do the ginger tea as well. And I would, if there's an ear infection, I would topically go in there with hydrogen peroxide, 3%. You can dilute it half and half, or you can do hydrogen peroxide and silver and put the drops in the ear. And I would do it topically that way, because does it make sense to give a systemic antibiotic for your whole body that's just going to here? So I would try to go in there with that. There's a product called Citricidal you can get as well. That's a citrus-based drop product that you can go in your ear, or you can do the hydrogen peroxide, or you can do the silver. And for me, I did the hydrogen peroxide dozens of times. It works phenomenal. It bubbles. It's a little scary and burning at first, but it works phenomenal. You can always dilute it down to make it a little less irritable. What's the functional range for fasting insulin? I would say between 2 and 5. Recently had a blood test in the urine. CT scan showed no stones or tumors, but something else, probably a blood clot. They want to perform a cystoscopy. Is that a good idea? Had a blood in the urine. So I'd want to know why there's blood in the urine. I'd imagine some kind of infection. So I would probably, that's a tough one. So blood clot, I need to know more information. But if you're having blood clots, I mean, I would do natural blood thinners to help make sure if it is a clot that, the natural blood thinners will help reduce it, and then redo the test. So you can do ginger's a great blood thinner, fish oil, ginkgo. You can do systemic enzymes like serrapeptase on an empty stomach. I would redo the test before I did anything invasive. Joseph writes in, how should I take activated charcoal while detoxifying? In between meals, between breakfast and lunch and dinner, 3 hours after subs and food, 1 hour before. Hope that helps. Hey there, Sherry. Any opinions on Plexus products? Their gut products. I've seen some of the Plexus product. I think some of them were pretty good. I remember them having a combined like Lactobacillus Saccharomyces product. Not quite sure. If you want to post some more specific information in the chat, I can get back to you there on the flip side. Let's see here. What do you recommend for sleep? Oh, that's a really broad question. Go check out my sleep podcast. If you have something more specific, I can answer it for you. What are some other common sources of inflammation except infections? Food. Foods are going to be number one. Of course, stress. Of course, poor sleep. Toxicity in the environment, pesticides, lots of different vectors there. Wingsy says, is it okay to give an adult multivitamin to a small 2-year-old child daily? I would probably go with a children's multivitamin instead. Pure Encapsulations makes a nice multivitamin. I'd probably go with one that's on that lower side just because the nutrient levels could be higher. If you looked at the back of it and you compared and maybe you gave a half a capsule, I would really make sure you are giving it dose-wise so you don't overdo anything. Like things like iron, right? There's a reason why like on the back of the Flintstone chewables, like don't have too many, right? And the kids would always eat a ton of them. Then you get iron poisoning. So you got to be careful with things like iron because it can be hard on a child. Candida, can you talk about Candida overgrowth in the body? Well, that's another broad question. I have a whole podcast on that, Anna. So I would go to justinhealth.com, type in Candida podcast, and I can riff on it for you like for an hour there. But again, Candida is a yeast or a fungus, right? Like fungus is like the bigger umbrella, and then like there's a smaller umbrella called like yeast. And Candida is a stressor. It's a toxin, or it's a fungus, like I mentioned, and it produces toxins like mycotoxins that can screw up motility and digestion. It can also produce acetaldehyde, which is a stress on the liver. Acetaldehyde can get metabolized into salsalenol, which can also affect the midbrain and affect dopamine cells. So it's a stressor on the body for sure. It can increase leaky gut. When your gut's more leaky, you have more immune stress because your body's having constant undigested food particles, and LPS get into the bloodstream, and that can stress out the immune system. So that's a good starting point, but check out the podcast. Hope that helps. Where am I at here? What's your protocol for a cyclical intermittent fasting? I mean, for me, like I try to do just some really good butter coffee, and I do about 15 to 20 grams of collagen proteins, or my true collagen, which is the collagen amino acids, less gluconeogenic. I like that because I want to eat in the morning. I want to feel good. But some days on the weekend, I'll take a day and I just won't eat anything till 12 or 2 o'clock, and then I'll break that fast. But that can be helpful. Absolutely. Keep it simple. I like a 16/8 or an 18/6. So typically 16 hours of fasting, 8 to 6 hours of eating. How many herbs should you take at once to clear Candida? So in my line, I'll typically do a combination of GI Clear 1, 3, and 5, or 1, 5, and 6. So the 5 is a pure oil of oregano. That's a carbachol extract, very, very potent. The 6 has some Podiarco in there. Podiarco is great with Candida. It's got some olive leaf too. 3 has silver in there. Silver is also shown to be really helpful against Candida. And if you have like Candida in your mouth or like kind of a thrush-like thing, you can gargle with it, and that can help with Candida locally in the gut as well. Sherry writes, I noticed my daughter breaks out on her face with a rash whenever we go to the park and she's in a grass. Or let me see if I can read the rest of that. I'm not sure if I can read the rest of that. Let's see. It's just giving me a ... after that. If you can give me everything after grass and touches in another chat, I'll be able to see it. Let me see one more thing. Yep, can't quite see it. So regarding that, if she's getting a rash, I would look at some kind of pesticide or some kind of chemical on the grass. It could be Roundup, right? Roundup or glyphosate. So it's probably some kind of chemical or stressor. I would definitely, get some kind of like a wipe thing and wipe the kids down. We have like one for my son that we use. It's just natural essential oil wipe, and just kind of wipe it off there. That could be helpful, but that just may be an environmental thing if it's a park and they're using chemicals. So that's a toughie. But if you want to write the rest of your sentence in there, I'll take a look at it again for you. Guillermo writes in, does microwaving lower your food's nutrient quality? Yes, there's some studies showing that lowers nutrient quality 95% broccoli that's microwaved. There are some research showing that. They don't even, it's really interesting. They don't even microwave. And again, this is kind of a common sense thing. Like they use like almost like a convection oven if you work in a hospital to heat up blood, right? And the reason why is if you put blood in a microwave, the transfusion won't take, right? So it's not good. You have to actually heat it up convection wise. So I try to use a convection oven for heating my food up to maintain nutrient density. See here, Rashan says, I'm 40 years old. I have UC, I think that's ulcerative colitis, SIBO, small intestinal bacterial overgrowth, low stomach acid. Why does burping increase a lot when I lie down, even 3 hours after dinner? Also, increased burping is followed by a headache very soon. Idea why? Yeah, because more than likely with all the issues, you got gastroparesis, meaning the food's just sitting in your stomach for a real long time. And because the food's sitting in there, then when you lie back, it's all kind of making its way back up. Right. Typically fermentation of food in the gut or in the stomachs and then end up with burping. If it's going to if it happens in the small intestine, it's going to be typically gas or flatulence. So yeah, you need to get your digestion working better. So I would be using natural prokinetics like ginger, chamomile, those kind of things to help get that food emptied. And I would use stomach acid and enzymes. And if you're having a lot of gastroparesis, you may want to go heavier on the enzymes and less on the stomach acid because the food may sit in your stomach too long where the acid may create some irritation. But a little bit of acid, a lot more enzymes. Riley writes in, if you have delayed IgE reaction from food you ate a couple days ago with symptoms of fatigue, brain fog, etc., what would you do to reduce this inflammation response? So number one, I would try to do more enzymes and HCl with those potential foods. You could always throw in some charcoal after the fact, and then potentially some glutathione or some curcumin to help with the inflammation and to help with the detoxification. My sister was diagnosed with endometriosis. What are the most important things to do functionally? Well, endometriosis is basically endometrial cell growth outside of the uterine lining. So it can happen like on the ovaries, on the uterus. And typically they don't really know what causes it, but there's definitely like an inflammatory response to it. So any type of excess inflammation will definitely increase endometrial growth. Of course, estrogen dominance will as well. So make sure you're not getting exposed to exogenous hormones from food, from pesticides, from water. Number two, get your insulin levels in check. High levels of insulin can definitely throw off your hormones and drive that. And then number three, I would make sure that, you look at your hormones. Like sometimes women are going to be low in progesterone as well. So I'd work on supporting that progesterone estrogen balance. And if you don't know where you're at hormonally, then I would just use herbs to do it to start, along with a really good, typically a lower carbohydrate paleo template to start. But then outside of that, we'd have to dig in deeper. What's the difference between Adeno-B and Methyl-B? Well, Methyl-B is basically, it has a carbon and 3 hydrogens next to it. And Methyl-B is going to help more with the methylation pathways. Adeno-B, from what I understand, the adeno is going to help more with the mitochondria. It has more of a mitochondrial effect, where the methylation is a little bit different. It works in the methylation pathway. So more of a biochemical question. But I will typically give methylated B12. And then on the organic acid test, sometimes it'll say adenosyl or hydroxyl B, and then we'll give a separate B12 with adenosyl and hydroxyl in that. Does fungal overgrowth show up on a CBC? Maybe. I mean, maybe you could see an immune response that's out of balance. Maybe you could, elevation in neutrophils and lymphocytes could be bacteria. Low lymphocytes could be a chronic infection. Basophils are typically more going to be histamine. Mast cells can be tissue inflammation. Eosinophils are going to be more parasites and allergies. So maybe, but not specifically. You'd want to do either Candida antibodies, Candida PCR testing, or Candida stool. Let's see here. What about heart spasms? No atherosclerosis, EKG abnormal with ST depression. So I would, number one, make sure that insulin levels are in check. Number two, I'd also make sure mineral levels are in check. So most people with heart issues, most people aren't getting enough potassium. So 4,700 milligrams of whole food source potassium, green vegetables, avocado, like healthy animal products, 4 or 5 servings of green veggies a day, at least 1 full avocado. That's going to help. That's going to help for sure. And then get the insulin levels under control, because insulin can really screw things up. And weakened adrenal function can cause you to pee out a lot of your minerals. So you can have lower minerals just because of lower adrenal function as well. Touches flowers. Then Sherry writes back saying her daughter has the allergies, touches her flowers, and then touches her face, experiences 30 minutes, grass out. It could be an allergy. It could just totally be an allergy to the pollen, to the dander. I know your daughter has some, I think it's some Hashimoto inflammation stuff. So I'd, work on getting that stuff under control. You can use natural things like stinging nettle and bee pollen to help with some of like allergenic reactions. Bromelain as well, higher dose vitamin C, and see if that helps. If it doesn't help, it just could be an IgE kind of inborn allergy, and you just got to be careful with it. Could be pesticides, but now that you're saying it that way, it sounds more like an allergy issue. I would try using some of the things I mentioned, and hopefully that helps. All right, where am I at here, guys? Okay. Can drinking too much water prevent you from losing weight? I'm desperate to lose weight. I'm 250 pounds. I decided to see how much I'm drinking 5 to 6 liters of water a day. So that's about 1.25 gallons to 1.5 gallons. I mean, I don't think it's going to cause you to not lose weight. I would just make sure the water is clean, because water, if it's not clean or filtered, it can be a big source of toxicity. A lot of unfiltered medical drugs in there, a lot of, heavy metals in there. So make sure it's really good, clean, filtered water, at least a really good carbon filter and or a reverse osmosis filter. If it's reverse osmosis, make sure you pinch or add back in some minerals, because it'll be very mineral devoid. And I think I would just go from half your body weight in ounces, and just get your urine so it's just a light tinge of yellow to it. Not so it's 100% clear, not so it's super yellow, but kind of right in the middle. Any tips for getting rid of vaginal yeast infection? Number 1, clean out your diet. Make sure excessive sugar, those kind of things are out. Birth control pills can also drive it. And then number 2 is you can topically use, I use a couple products that are suppositories like boric acid and or berberines, and we use that as a suppository to help knock down the yeast, but you got to prevent the feeding of it as well. We can also throw in some Saccharomyces boulardii, and even some good female probiotics can be helpful with that. Let's see here. Karen writes in. Let's see here. Daniel. You heard of the Wim Hof breathing method? Is it beneficial in your opinion, or just pointless? I think Wim Hof is interesting. I think it really is. I did a podcast, or I did a YouTube live back in April of this year on float tank therapy and the Wim Hof method. Go take a look at that video. I talk about it in there, but I think there is something to it for sure. I think the benefit really comes from increasing CO2. And by increasing CO2, there's some vasodilating effects that happen in the brain with increased CO2. And that may be some of the things that you're seeing happen in there for sure. Any ideas why headaches follow an increase in burping? If you're burping, number 1, you're not digesting what's in your stomach. So there's probably just some fermentation process that's happening in your stomach due to poor digestion. So fix the digestion, and maybe the fermentation byproducts like acetaldehyde or something else, maybe they're driving it. And maybe if we decrease the poor digestion in the stomach, that will help improve the headaches. Definitely something I would look at. Of course, adding in a little ginger could help too. What do you think about moringa superfood to treat RA inflammation? Moringa. Not quite sure. If you can give me a little bit more intel on it, that'd be helpful. What's the best treatment for Lyme disease and co-infections? Well, number 1, you want to make sure everything else is dialed in. Diet, lifestyle, gut infections, detox. Do all that stuff first. But a lot of people I see have Lyme issue or Lyme co-infection issue, but they have so many other things that are going on that aren't in order. So many doctors I'm noticing are coming in, they're seeing Lyme patients, and they're getting so myopically focused on the Lyme where everything else is just kind of ignored. But some of the herbs that are great are going to be Morinda or Noni. I like silver, cordyceps, cat's claw or cemento, berber, banderol, Sitta, cryptolepsis. These are all phenomenal herbs at treating Lyme. What's your thoughts on using Ritalin for cognitive impairments associated with schizophrenia? Ritalin's going to be more of a stimulant. I would get to the root cause, right? Big connection with gluten sensitivity and schizophrenia. I would start there personally. Get the diet clean, see what happens. I've seen many patients with significant diet issues improve a ton with their schizophrenic symptoms. I have low thyroid and SIBO. Would that cause my food sensitivities that I have, and how would I fix it? Yes, definitely could. Low thyroid can decrease motility, so food moves slower. slower digestion. SIBO was a bacterial overgrowth. That can also disrupt digestion. It can also drive leaky gut. So, of course, the more leaky the gut is and the poorer the digestion is, the more those undigested food particles get into the bloodstream and can create immune response and food sensitivity. So fix the leaky gut. 6 R's, remove the bad foods, replace enzymes, acids, repair the gut lining and adrenals, remove the infection, repopulate probiotics, retest. I have what I believe is a hypersensitivity, fight or flight response is debilitating. Would you suggest may help this raging issue? So number one, I would get the adrenals worked on. So make sure the diet's good, make sure the adrenals are worked on. And depending on what brings it about, I would work on doing some EFT tapping techniques to get the subconscious short circuiting addressed. I use Zero water filter. It removes all dissolved solids. Oh, I use, okay, I guess the Zero is a brand. Is that bad in terms of minerals? Yeah, I mean, it is. You definitely want to have a good sea salt or a good trace mineral support that you can pinch back into the water for sure. Let's see here. I'm on an autoimmune paleo diet, but I had my thyroid tested and I have no antibodies, so I guess no autoimmune disease. Do you think it'd be safe to go to a paleo diet? My symptoms are all hormonal. So number one, typically at least a couple of weeks on an autoimmune diet, and then do a reintroduction one at a time, one food every 2 to 3 days. As long as there's no new symptoms, that's great. If you went on the autoimmune diet and you didn't see any benefits at all, no improvements at all, then, you know, if it's been a couple of weeks, then you can progress and move back towards a paleo, one food every 2 to 3 days. Look for any negative symptoms that may arise. Any recommendations for palliative short-term for stress and anxiety before a proper consult? Can anything be done? Yeah. So one sec. Easiest thing just for stress and anxiety. I mean, there's two kind of go-tos for me: magnesium and ashwagandha, right? These are kind of two go-tos. I'm going to have some ashwagandha right now. They're going to help with anxiety. They're going to help with stress. And also just don't skip meals. Have a good breakfast, have a good lunch, have a good dinner. That's going to stabilize your blood sugar. And also it gets nutrition into your body too. Okay. Do you ever go to Italy? Love to. I was in Croatia last year and Czech Republic. Look forward to going soon. All liposomal vitamin C appear to be synthetic. Any recommendations for a good vitamin C? I like a really good buffered vitamin C with some minerals in there and some bioflavonoids. Mine is vitamin C Synergy. It's just got the good ascorbic acid, which is kind of like your vitamin C, or it could be more synthetic because it doesn't have the bioflavonoids. With mine, we add like the rutin and the hesperidin and a lot of those bioflavonoids back. So that's helpful. Does B vitamin 17 exist? I think B vitamin 17, that's the one they use for cancer. I think it's extracted from an apricot seed, and they use that to help kill cancer cells. So I think there's something to that. I think they've made it into a kind of a pseudo kind of drug called Laetrile as well. And who did a documentary on that? The Truth About Cancer by Edward G. Griffin. That's the one. Take a look at that. What's your thought on intermittent fasting? I already reviewed it. Take a look at my videos on it. I think it's a beneficial tool. Just make sure you're in a good place before you do it. Some patients can feel a lot worse if they're not in a good place. I'm on a strict keto diet. However, when I'm on my menstrual cycle, I'm thrown out of ketosis. Why does this happen, and what can I do about it? It's probably happening because, number one, you're probably losing iron. So that's having some stress. It's creating a stress response. Maybe it's affecting aerobic metabolism. So if you're menstruating a bit, that could easily throw your iron a bit low. That could affect your metabolism and you generating energy and ATP. And just your hormones being a little bit off may throw off your cortisol and progesterone. So I would listen to your body. If you need to add a little bit of carbs in during that time, if you feel a little bit better doing it, listen to your body and do it. If you feel good keeping in that keto range, I just wouldn't worry about it. I would get through it. Once you're off the menstruation cycle there, the menstruation part of your cycle, I think you'll start to improve. You can also add a little bit of liver in there as well. That will replace some of the iron you're losing. How does IF impact female hormones? Did a whole video on this, but blood sugar is one of the biggest. Blood sugar fluctuations is one of the biggest stressors on your hormonal system. And gluconeogenesis, which is part of what happens when you're fasting, it requires cortisol. So if your blood sugar is kind of already lower and your adrenals are more kind of, let's say, dysfunctional, they can't quite pick up the slack of the lower cortisol, that may put more stress on your adrenals. That's how. But take a look at that video. Is it safe to take a valerian skullcap in a powder form? Not quite. I mean, if it's good quality, yeah, a lot of those herbs taste nasty. So you just got to make sure you can get it down. But if you can get it down and then you know it's from a good quality source, like maybe Herb Farm, for instance, then I'm okay with it. What's the cause of pain during menstrual cycles for some women? How is it best managed? Typically, the pain is driven by the fluctuations in estrogen, and that causes like contraction. So it can cause contraction of the uterus or contraction of the vaginal tissue, and that can cause tightening. That's why women who have fibroids, like little fibroids, it's like causes more pain because you have this contraction and then you have this like little benign tumor in there too. So it's the muscle contraction. So you could do like anti-spasmodic herbs to really help relax the muscle, or to relax that kind of contraction. You can do like cramp bark extracts, phenomenal. And then of course, just your everyday really good estrogen and progesterone modulating herbs like maca and chaste tree can really help modulate it. How often should I donate blood for the benefits like reducing too much iron? Again, if you're a guy, which your name is Guillermo, so I'm assuming you are, typically I would say 2 to 3 times a year is good. That's something I have to do better. I'm only doing it like once a year. I got to step it up and do it 2 to 3 times. So that's a good reminder for me as well. All right, guys, phenomenal chat today. I'll be back on, I think, for a podcast. Let me check my schedule. I'll tell you in 1 second. Am I back here today? I am not back here today, but I'll be back on Monday for a phenomenal podcast. If I have time, I'll put out a YouTube video as well. Any topic suggestions, feel free and let me know. I appreciate the feedback. And y'all have an awesome Friday. Take care.